Medical professionals of Reddit, have you ever had a patient so lacking in common sense you wondered how they made it this far? If so, what is your story? Story 1. 73 here, former clinical microbiologist, long ago. Still, I found myself all over the clinical lab at times, not just infectious disease. So one day, this 20-something guy, wife and mom in tow, walks in with a paper request for semen analysis, pre-computer era. Okay, not the most comfortable encounter, but I'm a professional, and did this drill many times. He had not been briefed by the doctor, and had no idea how establishing infertility in males was done. Well, okay, a challenge, then. I took him aside, and, using standard medical terminology, told him how a diagnosis is made and what he needed to do to provide a specimen. He wouldn't believe that I was asking him to masturbate into that container. Astonished. Then he played dumb, as if the word was unfamiliar to him. We looped through the medical terms and procedure again, and I eventually resorted to every word I knew to describe the act. It was like a George Carlin bit. A half-hour later, he emerged from the toilet with 2 inches of urine in the cup. God almighty. The report went back, patient provided improper specimen. Story 2. I work in home health. At my last job, I had a lady call saying she was returning my call specifically. I don't recall her at all, and when I check for anything on her, it shows we have never received a referral or anything for her, which I tell her. She gets mad and starts screaming at me, won't let me get a word in to tell her to call the discharge planner at the hospital. Like a good 8 minutes of her screaming at me, calling me heartless, an idiot, you name it. Whatever. It's slow, and these calls are usually good for a laugh. She takes a breath. I say, "Ma'am, I'm not sure who called you, especially since we haven't heard of you before now." She interrupts with, "No, it was definitely you. You said your name was Shelaton, and you were calling from Advanced Home Health." "Ah, we have detected the problem," I tell her. "I see what's going on. You accidentally called Amber Care Home Health. Let me get you Advanced's number." Then she says, "I have it. They didn't pick up the phone, so I called you guys. I was not expecting that one." Story 3. Paramedic. Elderly woman complains that her mouth is dry and she felt a bit dizzy climbing the stairs earlier. Go through the whole rigmarole of getting a medical history, vitals, more detail on symptoms. Ask her what she's had to drink today. A cup of tea, 10 hours ago. Any water? No. Guess what fixed it within 5 minutes? Story 4. Physical therapist. Had a patient with neck pain and spasms. Also complained of anxiety and heart palpitations. Asked about caffeine intake, and patient revealed drinking an average of 20 cups of coffee daily. Story 5. Had a buddy who was an EMT. He was called out to a location for a gunshot wound. Apparently what happened is a father was mowing his lawn when he accidentally touched part of the mower near the engine and burned his hand. He got mad at the lawnmower, pulled out his pistol, and shot it. The bullet ricocheted and hit his son in the leg. Story 6. Pharmacist here. I had a woman bring in a literal sandwich bag which she kept all her meds in. She needed help seeing which meds she was low or out on and asking different questions on the medications. When she pointed to an apoquel stating it was her blood pressure medicine, I immediately became concerned as to why pet medicine was in her bag, only to find out that she had been throwing her pet's med inside her bag of medicine. So Lord knows what she's been giving her dog or taking herself. I immediately stressed how important it is to keep medicine in its original container to protect the medicine and herself, and to know the directions of how to take it. I've seen her a few times since then, and glad to see she has since taken my advice. But how any pharmacist or doctor hasn't advised her on this before is beyond me. Story 7. I'm a pharmacist. One evening shift, I was working a relief shift, not my usual pharmacy. A man comes in looking distressed. Man. I had sexual relations with a woman I do not intend to pursue a long-term relationship with. Yes. He said it. Just like that. Me. Okay. I'm assuming there was an accident, or it was unprotected. How long ago did it happen? Man. Last night at 7 p.m. on the couch. Whoa, TMI, I just need to know approximate time to know if Plan B will work. Oh, right, oh. Me. We have this medication called Plan B, and since the incident happened within 72 hours. Man, oh yes. I got that for her already yesterday, right after we finished. We want to know if there is anything we can do to know if she is pregnant now. Me. Unfortunately not. She'll have to wait 3 weeks or so to see if she gets her period, and if she doesn't, then she can do a pregnancy test then. Theoretically, you could do a blood test for faster results, but that would also not be until a couple of weeks at least. Man. We're just really anxious because she really doesn't want to be pregnant. Is there anything that she can take to prevent the pregnancy? Any multivitamin? Minerals? Food? Me. She's already taken it, which was the plan B. There are some other options, but those are prescriptions. And no, there are no over-the-counter products she can take. Man, what about me? Is there anything I can take now to prevent the pregnancy? Any multivitamins or minerals? Me. No, sir. There isn't anything you can take now. Story 8. Physiotherapist. For those that don't know, after a total knee replacement, you basically have a 6-week window after the surgery to regain the range of motion. If you don't regain the range in those first 6 weeks, it ain't coming back. Had a patient who was a farmer, who was very enthusiastic about regaining the range because he needed to be mobile for his work. Saw him the first time about 5 days after surgery, showed him all the basic exercises, told him to not do any farm work for at least 6 weeks, and told him to come back to see me once a week for the first 6 weeks. He disappeared and came back about 8 weeks later. His range was non-existent, maybe 30 degrees of range in total. He was visibly mad at me, as if it was my fault, actually was shouting and calling me incompetent. Our conversation went something like this. Have you been doing the exercises? No. How often are you doing farm work? Every day. Why haven't you come back since the first appointment 8 weeks ago? Too busy with farm work? So to summarize here, you did absolutely nothing that I told you to, and this is somehow my fault? Never saw him again. Story 9. Rural ER doctor here. 35-year-old female walks in with right-sided jaw-neck swelling. I think it happened because I ate some meat yesterday that my body is reacting to. 10 minutes later. Oh yeah, and I accidentally swallowed a bee, and it stung me in my mouth right before this happened. Sorry, I forgot to mention that. Story 10. Not me, but my mother would pick up shifts as a nurse sometimes in labor and delivery, and she had met a handful of women who didn't know the baby was going to be coming out of their vaginas. Like, no clue. My mom usually said something like, "How you got it in is how it's coming out, honey." This was the late 90s, early 2000s. Story 11. Not me, but my wife, who is a vet. Had a client who got mad at her because he didn't realize that once he neutered his dog that he wouldn't be able to breed it. Replies, as someone who worked at a vet office, I am completely unsurprised. We once had to explain what smegma was to very embarrassed owners of a new puppy who brought him in for discharge around his private area. Not to mention the countless people who bring their cats in asking about a lump only to be told it's a nipple. And then you occasionally get the inevitable, but he's a boy, and have to explain that male mammals have nipples too. Like, ma'am, you are married. Have you never noticed your husband has nipples before? Story 12. Working midnight in the ER. Family brings in a 4-year-old at 2 a.m.-ish. I ask them what is wrong. Them. Ask him, the 4-year-old. He said he needed to see a doctor. Me. Did he say anything was wrong? Them. No. He said he needed to see a doctor, so we brought him. A quick back and forth that firmly establishes that they actually showed up in the ER at 2 a.m., purely because the 4-year-old said he needed to see a doctor, and they don't know why. Me to child. Why do you need to see a doctor? Kid. The doctor has suckers. Me. I was surprised. To be clear, it is the parents who lack sense, and not the kid. Story 13. Had an 18 or 19-year-old girl come in my ER with some complaint that required an X-ray. It's standard that we do a urine pregnancy test prior to imaging on any female of childbearing years. She insisted she'd never had sex, and there was zero possibility of pregnancy. We did the test anyway, and it resulted that she was pregnant. We did a blood pregnancy test to confirm the result since she insisted she couldn't possibly be pregnant because she had never had sex. That was positive too. We gave her a few minutes to herself to figure out what the hell happened. And when I returned to check on her a short time later, she asked me if she could get pregnant even though her boyfriend didn't go all the way in. She 100% believed that as long as his penis wasn't entirely in her, it didn't count as sex. It took nearly a half hour of explaining reproduction to her for her to understand that whether it's halfway in or all the way in, sperm travel. Story 14. Not a personal experience, but one from a colleague of mine. I only saw the pics. So this 60-something-year-old suffers from an acute complication and gets a pacemaker to solve the problem. Everything goes normally, and as planned, he recovers. Every care and meds that he needs to take are prescribed, explained, and medical appointments with a cardiologist/arrhythmologist are scheduled so that he may get the follow-up he needs. The man then proceeds to never show up to any appointment and never answer any calls from the hospital to know of him and reschedule. This went on for around 3 years, until he shows up without former warning and asks to talk with the doctor that did the procedure to put his pacemaker. People are weirded out, but seeing that on that day the doctor was present and this patient was in clear distress, they talk to him and manage a couple of minutes to have the doctor check on him. Inside the appointment room, the doctor takes notice that this man is wearing a bra inside his shirt. The man explains he has been wearing his daughter's bra for 3 months after his problem got worse. The shirt is asked to be taken off, and there he stands, the shirtless man wearing his daughter's bra, showing off the pacemaker that should have been kept inside his body, dangling outside of it, being held by the left bra cup, with a big infected open wound above it with the pacemaker lead still inserted into his veins and connected to his heart. Nobody has any idea how the man let that situation come to be, or how he didn't die of sepsis or any other health problem that may appear for that matter. Story 15. Had an adult male patient who needed a Foley catheter. His mother was in the room, and they both lived together in the backwoods of Tennessee. I informed them both of the order for a catheter, how it works, and why it was needed. His mother stated, "Well, he's still a virgin, and I'm not sure I'm comfortable with his virginity being taken in a hospital." Story 16. I work in veterinary medicine, and clients are absolute idiots who are convinced that they are the smartest people in the world. It is amazing that pets actually manage to stay alive. People will believe just about anyone else over the advice of their veterinarian, their breeder, their relatives, their lawnmower, the person bagging their groceries. I had a client blind their cat with tea tree oil because they read about it on the internet. Clients change their pet's medication dose for whatever reason. That's really fun when it is insulin. Not follow post-op instructions, causing their pet to eviscerate itself or blow the knee we just repaired. Feed their dog pot roast with garlic and onions as their bland diet for gastrointestinal upset. Heck, last week I had a client scream at me because we didn't give her an exam room with a view. We don't have exam rooms with outside windows. Story 17. Saw a chart once where a person came in for a burn to their eye. They told the doctor they read online that warm milk in the eye can help with irritation, and their eyes were irritated. So they boiled milk and then poured it in their eye, burned it all. Story 18. EMS here. Had a diabetic in his 30S40S who refused to take insulin since 2012. It was 2020 at the time. When I took his blood sugar, it only read as high, meaning it was over 700 for glucometer to not read it. Upon seeing this, he asked me if that was high, and then went, "Is this because of all the ice cream I ate?" Played Facebook Messenger video with his girlfriend the entire time. Met him later in the parking lot after he got discharged, and it took this man less than 50 paces from the ER door to rip off his bandage covering his IV and play with the IV wound until it started bleeding all over the place again. Knocked on our ambulance door and asked for a bandage to fix it. We had to walk him back into the ER and bandaged his entire arm with gauze so that, hopefully, by the time he got it off, it would have clotted enough for him to not end up exsanguinating himself. Story 19. Pharmacist. Don't even know where I would begin for some of the ridiculous situations I have had up there, however has to be whenever I had a lady swallow a full box of suppositories and came in to complain that the issue has not cleared up and the medication tasted bad and was hard to swallow. Do sometimes wonder how people put one foot in front of the other. Story 20. This was one of the funniest yet cutest ones, was a student doing a shift in andrology, reproductive health. Doc. So you're trying to have kids, but not managing to. So do you have any other kids? Patient. Yes, Doc, I have one. Doc. Okay, so we need to do this and this and that. Patient. Okay, great. Then he proceeds to visit him and stuff, after which he goes away. After a couple of seconds, he knocked on the door again, saying, "Hello, Doc. My wife told me that it would be relevant to you that the son I have is adopted, but that makes no difference to me. I always considered him my own son." Story 21. My sister told me a story of a woman with chronic blisters and lesions on her lips. They couldn't figure out what it was for weeks. It would heal and come back, heal and come back. Turns out, she would jam out on like 3 bags of salt and vinegar chips a day for weeks at a time until the sores hurt too bad to continue. Then she'd go to the doctor. Story 22. Not a medical professional, but I used to volunteer at a free medical clinic to take vitals and histories. A woman came in with pneumonia and wanted to know why her normal treatment of drinking half a bottle of Listerine and smoking a pack of cigarettes a day wasn't working. I asked why she thought smoking was a good treatment for a lung infection, and she said, "Indians used to purify the ground by burning all the weeds away before planting, so I'm smoking to purify my lungs." I left that one to the doctor. Story 23. My wife is an anesthesiologist. When training junior doctors, one of the things she has to reinforce over and over again is that you never leave drugs unattended in an unsecured area in a hospital, even for a moment, because some people see drugs and think, fun, and take them even if they don't know what they are and they just raided a trolley or picked up a syringe off a bedside table. And then, because the drugs used for anesthetics in hospitals are quite serious, those people quite likely end up dead or vegetables. And this has actually happened more than once in hospitals she has worked in. Story 24. When doing a medical resupply in Iraq, one of my dudes lost a cooler of rocuronium, a whole flat of vials just somewhere in Iraq. Rocuronium isn't a fun drug, it's a paralytic. You just stop breathing, completely awake and aware of what's going on around you. Anybody remember the Vanderbilt med error? Similar drug, vecuronium instead of rock, both non-depolarizing neuromuscular blockers. We all just waited for news of some soldiers or Iraqis dying mysteriously after sampling the rock, but never heard anything. Story 25. VetMed here, we get a lot of patients who need to go on medications for a wide array of persistent problems, and these medications keep them under control, so we often get ones with thyroid, diabetes, heart issues, etc., and start them on medications. The patient starts to do great, comes in for another recheck, and is awful. We ask the owner if they are still giving the medication. Nope, they stopped it because they were all better. We fully educate the owner, go over medications, and give notes on what to do, and they still do this. Story 26. Former vet tech. Had a woman scream at me and my vet for telling her it's the law to have your dog vaccinated against rabies. She said the rabies vaccine causes autism in dogs and makes puppies stupid. Side note, 3 weeks later, her puppy died of parvo. She got another one immediately after and did not clean her home. 2 more died in the following months. Animal control and the city had to get involved. Story 27. I heard a story about a patient on whom it was impressed that she couldn't miss her fractions of radiotherapy if she was busy, and to inform us if she couldn't make the appointment. She couldn't make it. So she sent her twin sister to receive the radiation therapy in her place. She answered yes to all the ID questions, had the same birthday, etc. It was noticed when radiographers had trouble matching her to the CT, because the CT was of a person who had undergone a mastectomy, whilst the patient still had both breasts. This, many years later, is told to new staff during training about the importance of ensuring correct identification, because you would be stunned at the number of people who try to skip the queue. The number isn't high, but it isn't 0. Story 28. ER nurse with 7 years of experience. The list is nearly endless. People with massive burns because they smoked in bed is not as rare as you'd think. But the one that got me the most was a guy who came in for chest pain and fatigue. EKG revealed he was having a really bad heart attack. Activated our cath lab for emergency stents to hopefully save the guy's life. They almost always access the patient through the groin for the procedure, so one of our jobs in the ER is to shave the patient's groin to prep them for the cath lab. We get the clippers out, we don't use actual razors anymore, and informed the guy we needed to shave him. He refused. No problem. We will let the cath lab do it once he's knocked out. Nope. The guy refuses to sign the consent for the stents because he doesn't want his pubes shaved. After trying to educate him, pleading with him, and contacting every goddamn lawyer the hospital has. The guy signed himself out AMA and went home. He would rather die than have his curlies shaved. We looked up his address, and we weren't the closest hospital, so if he died at home, medics would take him to a different hospital. Doubt he survived the day. Story 29. I used to be a medical oxygen tech, mostly doing in-home work. One guy was on such a high concentration that he would have drawn nearly 0 oxygen from breathing regular atmosphere. This required 2 heavy-duty machines, hooked up in tandem just to keep him barely alive. This was explained ad nauseum to him and his wife, with full signed documentation of every conversation. They'd shut one machine off because they decided it was too loud. He'd take his mask off because he decided it was too cold. She would unplug the hose if she decided it was in the way. So on and so on. literally everything you could think of that would restrict or cut off his oxygen intake. Then they would panic and call our emergency service when he started to have a reaction to no oxygen intake. I lived, not even 5 minutes away, right beside our EMS fire station, and the call would always come to me to fix the machines at random times of the day and night, 7 days a week. They refused to call 911 because they didn't want to make a scene. This went on for ages, well over 18 months, until he was having trouble sleeping one night and shut the machines off before going back to bed. It's been years, and I still see the wife around town. She always glares at me as if I'm the one who killed him. Story 30. I don't know if cleaner in a hospital counts, but this one time I got to work early on a Saturday morning, and we immediately received a request for help from the ER and got sent over by my boss. When I got there, the first thing I heard was yelling from this guy behind one of the curtains. He was shouting at the nurses, "Don't touch my penis!" and "I didn't use any drugs!" Then I smelled iron in the air, and then I found out there was blood all over the hallway, handprints and blood against the wall. Almost the entire floor was covered in blood with actual puddles in some places. What happened? The guy pulled out his catheter, causing arterial bleeding, and decided to run away from the nurses who were trying to help him. It seems like he lived through that. I never saw that much blood before that day, nor after. Story 31. Work at a vet clinic. We get a lot of this sort of thing, oftentimes with diabetic patients. One of the worst I've seen was an older owner come in with their extremely overweight diabetic dog. Owner says the dog has been slow, tires easily, and has been flopping around, which is odd for her. Doctor checks her blood glucose, and it is so high it is literally off the charts. Normal blood glucose for a dog is around 100 or so. This dog was beyond 1,000. We asked the owners how it got so high. Was she eating? Clearly she was, because she was obese. Were you giving her the insulin? The owners proceed to say that they think she's probably fine without it. She's a strong and hardy dog. Ma'am, your 9-year-old, 80-pound Dalmatian is currently half alive on the floor because you don't give her the insulin. How they kept that poor dog alive that long was astounding. Story 32. Optometrist here. Patient booked in for an emergency appointment with a raging red eye, clearly very painful. Look under the microscope and the cornea is really not happy, wobbly reflexes, haziness, the works. Me. What happened? Patient. It's my niece's wedding this Saturday, and I wanted to tint my eyelashes to match my hair and the color scheme of the wedding, light blue, so I used the same dye for both to match the color. Me. Does that hair dye contain ammonia, by any chance? Patient. I think so. Do you think my eye will be better by Saturday? Will it match the color scheme? Me. Unless you can convince them to change the color scheme to red, no. Edited because I read a comment about healing crystals, and now I remember a story from a colleague. Patient attends a routine test complaining of gradually reduced vision, which turns out to be due to cataract. My colleague offers referral for surgery. No need, exclaims the patient. I know what I need for this. I have lapis lazuli at home. 6 weeks later, came back for the referral. Second edit for remembering the first story that made me question my sanity. Elderly patient attends with concerned family members because the patient ran over a pop-up tent on the side of the road that the telephone engineers used to protect themselves from the rain. Luckily, no one was hurt as the worker was on lunch. Worried as to how the elderly driver missed seeing a large red and white tent in the middle of the day, it was then that the elderly relative admitted to having spent the last 3 years driving from memory. Story 33. Not me, but sibling. I don't think he'd mind me sharing the story just on the off chance it prevents someone else from making this mistake. Lots of surgeons have a similar story, but thankfully, this one doesn't end in someone's death. Parents claim their child hasn't eaten anything before surgery, as they were carefully directed. Turns out they thought the surgical team was just being cruel to their child, and when she said she was hungry that morning, they detoured on their way to the surgical center and got her a full Southern breakfast. She damn near died aspirating biscuits and gravy. I've rarely seen my brother so angry and disgusted. Somehow biscuits and gravy looks even more nauseating the second time around, and he was just recounting what had happened. I have no doubt he tore a strip off the parents once their 5-year-old was stabilized, and they probably still felt justified and angry at the surgeon for telling them what they could and could not feed their child right before anesthesia. ETA. The parents did, in fact, feel justified and hard done by, although a fake they didn't express anger at my brother. Knowing him, they didn't get a word in edgewise. Definitely no acknowledgement or realization that they could easily have killed their own child or that they'd made a bad decision. I remember they were annoyed by her whining for food. Story 34. I worked in cancer research surgery a couple years ago. There are a good number of people who will refuse to have a small removal/surgery because they think holistic medicine or praying it away will work. They always come back, and we always have to remove so much more. One time, a patient had a melanoma on their calf, and the doctor wanted to do a simple wide excision, but they left because they wanted to pray it away. Came back a couple months later because it got bigger, and we had to amputate their leg. Pretty sure they had positive lymph nodes at that point, too. Story 35. I'm in the ER. So many stories. The one that left me dumbfounded was a woman brought in by her sister for pelvic cramps, amenorrhea for 3 months. Lo and behold, she's pregnant. Sister informs me that she sleeps with the Brazilian construction workers building the condo complex next door. I ask if they have any questions. The patient asked me if her baby would come out speaking Spanish. After a long pause and her sister staring at the ceiling, I told her, no, because they speak Portuguese in Brazil. Patient seemed relieved, and the sister hustled her out of the ER before I could discharge her. Story 36. Lady brings her baby into the ER with a rectal temp of 103. Kid's tacky as hell and looks so bad, refuses all medications, says she doesn't believe in them, and wonders why her herbal tea, she brought a jug of it, isn't working. Wants us to just check her out. Thinks a children's emergency room just checks them out. Try to explain why the kid needs an NSAID, keeps refusing. Says she doesn't know what's in it. I bring up that fact she had her kid in a hospital, and that she received medication herself, IV, epidural, etc. Doesn't budge. Only concerned for herself, told her that when the kid has a seizure or goes unresponsive and you call 911, you can expect the medics to give the kid everything it needs regardless of whether you like it or not. Only when the doctor threatened to contact social services for child endangerment and abuse did she start to listen, for like 5 whole seconds. Left against medical advice, people like this exist and breed. Story 37. As a pharmacist, everyone who comes in to buy homeopathic crap, especially for serious things. Once, a lady came in with a prescription from the dentist for some heavy antibiotics and painkillers due to an infection that threatened to damage the jawbone. When I asked if she knew how to take them, she went, "Oh, I'm not going to take those. They'll go right into the garbage, but I gotta buy them so that my dentist is happy. I'll rather stick with insert name of homeopathic crap here, instead of poisoning me with some devilish chemicals. Throughout the years, I've learned to just shrug and accept those Darwin Award candidates instead of arguing with them. Just infuriates me when I see that they've got children and pets." Story 38. Woman comes in with no prenatal care to labor and delivery in labor. OBGYN resident taking a history. Do you have any allergies? Patient. Yes, I'm allergic to water. Resident. Okay. What kind of reaction happens when you drink water? Patient. Oh, it makes me pee. Yeah, lady, that's a feature. Not a bug. Story 39. A woman called 911 because a cougar attacked her cat. She thought we could help the, very clearly dead cat. A man called 911 because a cow bit him. He didn't want EMS or an assessment or anything. A man called 911 for an itchy butthole. Took him to the emergency department because we have to. The doctor asked the patient if he had put the cream on his butthole that he gave him last time. Patient said no. Next time patient called us for his itchy butthole, I offered to put the cream on his butthole for him. He declined. Took him back to the emergency department. Story 40. I work in orthopedic rehab. Had a patient with a common fracture of the wrist the doctor sent over, since she was inexplicably getting stiffer and stiffer. I spent 17 sessions with her, 40-ish minutes each one-on-one time. Instead of just bending her wrist, she would contort her entire body. She had a career, married, raised kids, and seemingly functional adult. I tried everything to have her actively use her muscles to move her wrist. In front of a mirror, videos of myself doing the exercise, her doing it, and trying to spot the difference of moving your shoulder versus your wrist. The last time I saw her, I even strapped her arm to a chair and she didn't understand she was just trying to move her wrist. I will never understand it.
Story 41. When I was in the hospital as a patient, there was this one guy in the emergency room who really wanted to step outside to smoke. The nurses pretty much belted him on the table and yelled at him that he had complete kidney failure and they needed to treat him immediately or he would die in the next 20 minutes. To their dismay, he didn't listen and tried to vehemently free himself and go outside and smoke. He was in his 30s. It is a mystery to me how this guy survived that long.
Story 42. I work in clinical research at a hospital. Basically, for patients who have cancer and don't have other standard of care options, clinical trials, experimental treatment, are a viable option for many. Some people have a negative view of research, but it's highly regulated and not as scary as it sounds. We go through the consent form with this patient, who has a history of drug abuse. We don't know everything about this new medication, but one thing we do know is that using cocaine while taking this drug will make your heart explode, in layman's terms. This patient promises they're off the sauce and that they totally won't do cocaine while they're on the trial. 2 weeks later, they relapse, and, well, you can figure out the rest of the story. Story 43. My brother did a rotation in an emergency room before med school. Paramedics brought in a man with a lacerated neck. He was drunk and fell into a fish tank. His drunk buddies called 911. When the paramedics arrived, they realized his drunk friends had put a very tight tourniquet around his neck to stop the bleeding. Edit. I texted my brother to remind him about it. It happened almost 20 years ago. Apparently, it was worse than I remembered. The guy and his buddies were doing drunk WWE. He had a 2-inch glass shard stuck in his head. In addition to the neck laceration, dude came into the emergency room with no idea the glass was there. 4 different firefighters had to hold him down as he screamed sexist remarks at the female doctor. He said when they removed the glass, blood shot about 10 feet in the air. My brother, at that point, silently noped the hell out of medicine. He went on to attend Berkeley Music School and is living his best life as a musical producer and engineer, and is not arguing with rednecks about whether or not there is a glass shard in their head. Story 44. Dentist, here. Once, a stressed receptionist asked me to help her interpret a call. I thought maybe the patient was speaking some foreign language. No. She just wanted me to confirm that the patient was asking for his property back that we took from him last year. Last year, actually, being 4 years ago, but I guess time flies. And his property being a tooth we sent to grind into slides for analysis. While explaining that it was impossible for us to return his tooth, he started going on about his rights and his property. When I tell people to move their jaw to the side, they always ask, which jaw? Actually, not everyone, only adults. Children get the assignment. Story 45. A family member worked at a hospital and had a patient come in with really strange physical and seemingly neurological issues. Couldn't figure out what was causing it. Didn't match anything he knew of, and tests were inconclusive. He asked her to walk him through her day. Turns out she was drinking a cup of bleach a day and bathing in it to keep clean and healthy her whole life. Same with her family, who all died very young. She could not accept that drinking bleach was bad for her health. Story 46. Optometrist here. If I had a nickel, for every time someone said they use urine for eye drops, I would have 10 cents, which is not a lot. But it's weird that it happened twice. Story 47. I worked emergency department for 10 years, every day. Every day people come in, and it shocks you how they managed to evade death for that long. One of the worst was we had a guy come in. He was a twin. He told us he needed to get checked for STDs because his sister apparently just got one. We, of course, had to ask if he has had sex with her, and he said no. But they were twins, so what she has, so does he. After a collective sigh of relief that this wasn't some weird Alabama "you're my sister" shit, we had to educate him that is not how it worked at all. Story 48. Plenty, although the one that always sticks in my mind is a patient I met during my early years on a palliative care ward suffering from terminal cancer. She was only in her early 30s, and the only reason she had gotten so far gone was that she had relied on the healing power of crystals, rather than, chemotherapy. Story 49. I overheard a conversation between a nurse and a doctor and a patient in the emergency room. They were trying to figure out if he was very stupid or had a head injury. It was both hilarious and sad. He kept telling them that he was there for a hurt leg. He couldn't explain why his leg was hurt, how it was hurt, how he got there, nearly anything. I heard them talking in a hallway to each other. The nurse was convinced he hit his head. The doctor said, "No, he is just an idiot." Turns out the doctor was right. They got a hold of the guy's wife. She basically told them in the hallway he is always this dumb, and if she leaves him, he would get lost in his own house and starve. Edit. It sounded like his leg was visibly injured or swollen, but when asked what happened or how does it feel, he gave nonsensical idiot answers. Not like slurring, but in a regular idiot voice. It feels hurt. I was talking to Jimmy and we were doing our usual work and my leg hurt. Doctor, did something happen? What is the work? Him, something always happens. You know how it goes. I just want my leg fixed. Story 50. I'm a nurse. This isn't about a patient rather than my dad. He is convinced that insulin is what is giving people diabetes and doctors are prescribing it just to make money. After 30 minutes of telling him why that's wrong, he said not to be so liberal, and I didn't understand because I'm not a doctor. Story 51. I worked EMS for years. It never ceased to amaze me the things people will do to themselves or others for fun. Confronted with these types, my first question was always, at what point did this seem like a good idea? The weirdest one I can remember was a guy that put his penis through a large metal nut. Once he got erect, he couldn't get it off. Story 52. Okay, so not a medical professional, but hear me out for a second. I work in a gym and recently had a client come in for an induction. Basically, a walk through the gym, design program based on goals, needs, and physical capacity. The client, in her late 70s, has a shoulder injury, which the physiotherapist has said, the rotator cuff is barely attached. Client has been suffering in severe pain for years, and hasn't been able to use that shoulder, and refuses to go to the doctor as she doesn't want to see a surgeon, doesn't want surgery. I've echoed what the physiotherapist has said and have refused to do any upper body exercises because of how bad the injury is. The client would rather live in severe pain than seek necessary medical treatment and only takes pain relief medication when the pain is intolerable. Story 53. EMS checking in. Late 20s. Male called 911 for a mild headache, no alarming symptoms, middle of allergy season. Being good medics, we check all the things, totally normal vitals, no fever, no medical history. Just a mild headache that started about 30 minutes prior. Did he take Tylenol or ibuprofen or anything? Nope. He wanted to go to the emergency room to let the doctors handle it. Imagine the bills.
Story 54. Nurse here had a patient with a tibial plateau fracture that demanded to see the doctor because she wanted to quit her antithrombotic medication. Bad idea. According to her, it gave her a dry mouth. I explained to her that it was not a known side effect of that drug. This lady had type 2 diabetes and administered her own insulin. Dry mouth is a side effect of high blood sugar. Tested her blood sugar, it was too high. Turns out she was using the same needle twice. Story 55. My wife used to work at an urgent care in an undereducated community. I'd guess most of her patients would have you wondering how they made it to adulthood. Some notable patients. The guy who, after learning he had diabetes, vowed to make a life change and replace all his soda with Gatorade. Women who don't know anything about vaginas or menstrual cycles. The people who come in with a history of heart attacks and chest pain that feels like a heart attack, but I know my body and it's not a heart attack. It was always a heart attack. Guys with gross dicks, hygiene related. People who did their own research. The parents who didn't get their normally not complainy teenage daughter medical attention when she was screaming in pain. After finding out she had appendicitis, they took her home instead of taking her to the emergency room. Her appendix ruptured that night. Bonus. My kid was in the hospital and sharing a room with another patient. This kid was morbidly obese and was elbow deep in a family-sized bag of potato chips. The doctor came in and really gave it to the mom. Your kid has kidney failure and he's not supposed to be eating salty foods. Your kid has a major condition and you've missed the majority of his appointments.
Story 56. Not a medical professional, but a grandson of a patient. My grandma went to an ophthalmologist to get her new glasses. Her doctor wanted to get her to do surgery for cataracts, but my grandma was very rude and stubborn in her denial to do that operation. Her main reason? She wouldn't be able to bend down for some time. That's right. My grandma would have rather chosen to go blind than to inconvenience herself in a slight way. Luckily, we managed to convince her to do that operation, my parents, brother, and I. She awaits her appointments. Story 57. When I was an intern posted in the obstetric department, I saw a 42-year-old pregnant woman who came for an antenatal checkup. This was her 7th pregnancy, and she had only one living child. So she had 5 pregnancies previously, which failed, 3 spontaneous abortions, and 2 stillbirths. The 6th one was high risk too, and she had to get cervical circlage done. They stitched the cervix because it is too weak to actually hold a baby in till term. When the OBGYN asked her why she would put herself through pregnancy again instead of being content with her daughter, she replied, "My in-laws want us to have at least 2 children." Biggest Pikachu face moment in my life. Story 58. Not me, but my ex-wife works as an endoscopy nurse. People have to use laxatives because they have to be clean for the doctor to be able to see with the camera. With the laxatives, they have to drink a lot of fluid, 3, maybe 4 liters total, if I recall correctly, about 3-4 gallon to a gallon. Some people just don't do it because it tastes bad. Some people do laxate. LOL, autocorrect said lactate, but still eat. Some think the doctor just won't notice. Yeah, Margaret, they won't notice that your colon isn't empty when they go in there with an HD camera. They just don't understand why they do it, even though everything is explained by the doctor, and they get brochures and a link to the website via email. And believe me, I've seen the brochures and website. An average 8-year-old could understand. Also, a funny story from her. There was a teenage boy brought in with a dildo stuck in his butt. He didn't need surgery, but they did have to use some tools to get it out of his rectum. After the procedure, he apparently asked for the dildo back because it was his sister's. The answer was no, it was cleaned, and they have a trophy cabinet. Story 59. That's most patients. Honestly, they usually get that far through some combination of luck, bordering on divine intervention for some, endless enabling from family members, and access to emergency care and social services enabling them to continue. I had one in particular who was a blind alcoholic with Tourette's. He would drink until he collapsed in the road daily and was brought to the emergency room daily. He survived being run over by a bus and being buried in a snowbank with a body temperature in the low 80s, all to leave AMA to drink and collapse in the street all over again, daily. After about a decade of that crap, a leg infection he refused to treat got him. Story 60, just a former paramedic here, but hear me out. As I was pregnant, my ex asked me, "How much does a newborn weigh?" Me, approximately 3.5 kilograms. My ex, "And how much weight have you already put on?" Me, about 13 kilograms, 2 weeks before delivery. My ex, "So you put on nearly 10 kilograms of fat?" He has a graduate degree in mechanical engineering. Story 61. I used to be a surgical technologist and have since moved up. One time, some guy thought it would be funny to pretend to have a seizure right as we administered anesthesia. He apparently looked up malignant hyperthermia, which is a severe reaction to anesthesia that could end in death. And as he was going under, we couldn't wake him, so we had to bring the crash cart out and call a code blue in the OR to get this guy up. We did not do his elective surgery after that. Story 62. I always hate seeing the patient who weighs over 600 pounds and comes to the emergency department for shortness of breath and refuses to acknowledge that their weight may have something to do with it. It's not their weight that bothers me, it's the utter lack of common sense. Story 63. Lady took her friend's blood pressure medication because she thought without measuring that her blood pressure was high, had a severe reaction, home with EpiPen-type reaction. Then went home to take the bloody medication again. Further anaphylaxis. Story 64. While in PA school, I was educating a guy and his pregnant wife on a vasectomy. I'm about halfway through my deal when he cuts me off and asks, "Just give it to me straight, can I keep them in a jar after?" Dude thought he was going to get his balls chopped off at the request of his wife. Needless to say, he was very happy and much more on board to go through with the procedure. Props to him for thinking he was literally getting his balls removed to prevent having any more kids. Story 65. Not a doctor, but a patient, and was room sharing with another girl who needed surgery. Her instructions were not to eat. Every few hours, she'd convince someone, family members, to bring her fast food. The doctor was frustrated and refused to do the surgery till she stopped eating. She needed a clear stomach. She could not get a grasp on this, and said she had no choice but to eat because she was hungry. I was moved to another room on the 3rd day, but she still hadn't had surgery by the time I had moved. Story 66. Ambulance service in the UK. Our summers now top 40 degrees C/104 degree F with very high humidity, and our buildings are mostly built to retain heat and rarely have AC. I regularly attend people, mostly the elderly, who are sat in the extreme heat wearing multiple thick clothing layers with the windows shut. Ask them if they've been drinking plenty of fluids. "Oh yes, I had a cup of tea earlier, and my porridge had milk in it. I'm no Quincy, but I think we might have narrowed down the source of you feeling unwell." Story 67. Someone asked me how you catch a stroke. This is as the partner of said person was on the floor unable to stand due to left-sided weakness, no power. They both thought he could sleep it off overnight and be fine in the morning. 12 hours later, they decided they'd phone the doctors to ask if there was anything the doctor could give the person on the floor, who was also now incontinent. They didn't even get worried during the previous day when his face drooped on the left side and he was slurring his speech. I said he has had a stroke. Oh, how do you catch one of those? Story 68. Every day. Once had a 36-year-old girl for CT. Broke her leg sitting on the toilet. After talking to her, found out she had cancer she was trying to treat with herbs. Well, cancer spread to her femur, and she snapped it. Pretty sad. Story 69. Saw a comment once of a woman who was advised to eat a packet of oatmeal for breakfast each morning to help with her weight. She came back in for checkups over the course of many months and was somehow gaining weight faster, and blood work was getting worse, even though she swore up and down she was following the diet. Everyone was baffled until they questioned her further and learned that she had been eating a package of oatmeal cookies every morning for breakfast. Story 70. I floated to the COVID floor when I was a new CNA at the hospital. A 40-something man with no history of breathing problems was on 5 liters of continuous oxygen regardless of activity level. For those who aren't medical, that is a lot for someone that age. Older folks on continuous oxygen are typically on 2 liters during the day. He told every single person who came into his room about how COVID was a hoax. At that moment, I realized how deranged people have become and began to worry about my right-wing relatives. I was correct to worry, as when they got COVID, they proceeded to take ivermectin and shit their brains out, and still argued with me that it was smart to take it. Story 71. Uninteresting, common version, uncontrolled diabetic, screaming at the top of their lungs demanding 3 Ensure chocolate smoothies and 2 sandwiches and 5 orange juices for an after-dinner snack while having the AccuCheck flag his blood glucose levels as critical, 500 inches while also freshly amputated. Oh, and he'll follow you around the nurse station all day. Story 72. Wife brought dude to the emergency department because he wasn't really talking to her, or doing much for that matter, for 4 days. Turns out he stopped taking his blood thinners because I don't feel any better when I take it, and they could not afford it. Ducking American healthcare system. Anyways, he had a huge stroke. Basically, 1/4 of his brain was just liquefied mush. Please, Reddit, bring your loved ones to the emergency department immediately when they cannot talk to you. And for duck's sake, do not stop taking your anticoagulation unless a doctor tells you to stop. Story 73. I'm not in medicine, but my wife is, and got this story. An old man was admitted to their burn unit because he was smoking cigarettes around his oxygen tank and it exploded. Severe burns across his face and chest. This was the 3rd time it had happened to him. Story 74. Had a patient when I was a pharmacy resident get repeatedly admitted to the hospital due to CHF complications, shortness of breath, fluid overload, etc. She had been advised to follow a low-sodium diet, but no one had asked her what she had actually been eating. I asked what she usually ate for lunch, and she said instant ramen noodles every day, but she only added the seasoning packet and a little salt. Story 75. I'm not in the medical field. I just work with somebody who refuses to either get medical advice or follow it. His health has been getting progressively worse over the last few years. He says that he just wants the pain to stop, yet refuses to change any habits. Big alcoholic and chain smoker, and he's obese, on top of that. We're all tired of listening to him ditch day after day. I can't imagine what it's like to treat patients like him every day. I think I'd lose it at some point and blow up. Story 76. My wife had one yesterday. A person came in with a baby. The patient said, "Well, I can't speak for the baby, but I have a cough and a sore throat." My wife asked, "If you can't speak for the baby, then who can?" The patient was dumbfounded, perplexed about who could speak for her baby. Story 77. Respiratory therapist here. I was working in the emergency room one night, and we have a prison not far from the hospital I was working at. We had a prisoner come in one night, and the doctor asked me to get an EKG on him. I went into the room, did the EKG, and gave the results to the doctor. I asked the doctor why he was here, as the prisoner was acting okay, and didn't appear to be in any sort of distress. The doctor told me he was here because he shoved a flex pen up his dick. The doctor asked me if I wanted to watch the pen being removed. I proceeded to return to my office. The next night I worked, we had a different prisoner come in for the exact same thing. Story 78. I know of a doctor who once had a patient come in for burns on both of his hands. The patient had been working with a hot glue gun and thought that the glue didn't actually seem to be very hot, so applied some to the palm of his hands to test the temperature. It was extremely hot and painful, so the patient attempted to remove it by grabbing it with the fingers of his other hand. Story 79. I always ask doctors or nurses this when I can. Even though I'll never share names or places, my top two are a family brought a 14-year-old male to the emergency room complaining of severe stomach pain. Turns out he ate a whole bag of spits, seasoned whole sunflower seeds, shells, and all. He died a couple of days later because they couldn't remove them from his small intestine at that point. I scratched my eye with a spring-loaded stick at work recently and had to go to the eye doctor. Turns out, someone was eating meatballs and dropped one. He bent down under the table to get it and bumped the table. A fork fell. He looked up. Fork in the eyeball. 4 hours of reconstructive surgery later, his eyeball was saved by this amazing human. I'm not doing so bad. Edit. Thanks for all the replies. For what it counts, I don't think this is common knowledge. I only learned in high school because someone told me about it. Also, I'm happy that I've saved at least one life with this post. Spread the word. Don't eat sunflower seeds. Forks are bad for eyes. Story 80. Plenty. A patient came to me with a swelling in the inguinal region, which was likely an inguinal hernia. Just when I was about to examine him, I observed that his ears were pierced, and he was wearing a thread through those piercings. I was surprised. Usually, I see earrings or some other metal. So I asked him why he was wearing a tiny rope. He said it was to treat the swelling, hernia. To admit that I didn't laugh hysterically would be an absolute lie. Story 81. Not a medical professional, but was pregnant and attending parenting classes at the local hospital with my partner. One of the first classes included a tour of the pediatrics area and a detailed explanation of everything that would happen on birthing day. The nurse showed us some teeny ID bracelets and explained they put one on each of the baby's legs because sometimes they fall off. Q1 of the future fathers totally freaking out. None of us had any idea why until he bursts out with, "I didn't know they could fall off." Nurse carefully and gently explained that she meant the ID bracelets, not the baby's legs. Story 82. I'm not a doctor, but I play one on TV. I worked for 3 months as a secretary in a urological clinic. I was regaled with a story about a middle-aged man with a severe perineal and scrotal rash. Guy tried so many creams, his PCP at one point prescribed steroids, and it's just getting worse. It was a toss-up between a urologist and a dermatologist, and he could see a urologist sooner. The day he finally comes into our office, and when he takes off his drawers, he apparently smells like a wet fart. Turns out this guy was barely wiping his ass, and the swamp-ass mixture he was brewing between his booty cheeks was getting worked forward as he walked throughout the day and bathing his perineum and the back of his scrotum with shitty sweat leading to an out-of-control, blistering, oozing rash. Story 83. Have a homeless guy right now. He visited the emergency room 19 times related to a vicious gangrene infection to his right lower extremity. It should have been treated a year ago and amputated 4 months ago. He is under the impression he can use the injury for preferred housing related to medical issues. He is still on the streets. He refuses antibiotics and debridement. Very obviously mentally ill. ASOC is involved. Story 84. Dude, every day. I don't really have stories. It's mostly just unintelligent people. For every IQ, 120 someone is walking around at 80. I have all the time in the world for these patients. What concerns me is aggressive patients who do sketchy things. Simple people are great. Sociopaths are tough. Story 85. As a pharmacist, I was once reported to the police and the board of pharmacy because I used a different flavor in a compound. People cannot ducking count. I will have people try to argue they are due for a control a full week early on a 30-day supply. COVID, the ensuing vaccine debate, and the hatred I received during the entire ordeal when I was just trying to help people made me convinced we'd be better off without 30% of the population. I used to think we would all come together if a pandemic happened. I was so ducking wrong. Politics don't belong in healthcare, and people need to learn that not all opinions are created equal. Learn that you don't know damn about duck most of the time and accept that. The world will be a better place. Story 86. I do cancer research. One of the patients opted to refuse chemotherapy to pursue natural therapies. That natural therapy consisted of urine therapy, Every day, they were drinking their urine, but that wasn't even the strangest part. They were also boiling their urine down to where it was only a powder of what I assume would be crystallized urea, and smoking it in a crack pipe. To no surprise, their cancer progressed, and they ended up receiving chemotherapy. Story 87. My ex's dad was a gynecologist, and he told this story. He had a young couple that was having trouble conceiving. They both came from sheltered, somewhat religious homes and were quite naive. Thing is, the husband had a solid sperm count. The wife had no issues whatsoever. The doc was flummoxed. Everything was fine apart from some bruising around the wife's abdomen. After running all of these tests, the doc finally sat them down and said, "Describe to me exactly how you have sex, step by step." At this point, it all became clear. The lack of pregnancy, the bruises, everything. Turns out these sheltered, somewhat religious households didn't talk about sex, ever. So they had made some logical leaps. Babies grow in a woman's tummy area, so we need to get sperm into there. And, hey, look! There's a hole right there in the middle of her tummy. He was ducking her belly button. The doc asked, "Do you find pleasure in this?" and ejaculate, "Yep." Though I'm sure it wasn't quite so fun for her. The doc got to blow their minds, and then for Xmas I bought him a kid's book called Where Did I Come From?, which explained sex and childbirth for him to keep on his desk, just in case.
Story 88. So many. A lad who was admitted with mild confusion and generally feeling unwell. A&E identified that he had a sore tooth and tried to reassure him and send him to a dentist, but he insisted he needed an examination. Turned out he realized that cold water eased his tooth pain, so he drank 11 liters of water in 5 hours. He had low sodium due to excessive water intake. One lady who stated she was allergic to rhubarb. I commented on how unusual that was. She said she loved rhubarb, but a few years ago she had a terrible experience where she was violently ill with vomiting and had a rash for a few days. I asked her how she prepared it, and she said she chopped the stem and leaves and made a crumble with it. I advised her the leaves were poisonous and that it sounded like she was poisoned rather than having an allergy. She insisted it must have been an allergy, as she felt so unwell she thought she'd die and wouldn't believe me that the leaves were poisonous. Then, there were 2 people who wanted to cure their cancer naturally. One by eating only organic, plant-based food. She had a stage 4 fungating tumor and left behind a 3-year-old son. My own husband died of cancer when my kid was 4 and would have tried anything to live longer, so it was hard to bite my tongue. The other one tried to cook the cancer out of himself by heating his home and sleeping by a radiator with several coats on. He was the only person I admitted with a high temperature that didn't have an infection. The U.S. nurses in states with no sex ed have the best stories, though. So many immaculate conceptions. Story 89. I'm not a medical professional, but I have 2 stories. A lady I worked with once wanted to try a keto diet the same time she was going on a cruise. Worst timing ever, LOL. She told us later how she struggled to avoid eating protein the whole time she was on the diet. I remember hearing a story of a patient with diabetes being taught how to give themselves insulin. However, the person teaching them demonstrated by injecting an orange, representing the skin. The patient misunderstood and proceeded to take insulin every day by injecting it into an orange and then eating said orange.
Story 90. I was in my last year of internal medicine residency, spending a month covering nights at one of our local hospitals. A nurse paged me around 10 p.m. with the message, "Can't place Foley in PT in room 66. On my sign-out list, it said the patient was a 70-year-old man admitted for advanced heart failure and needed the Foley catheter to track urine output while the team was trying to diurese the fluid off of him. I head over to the ward this patient was on and asked the nurse what the issue was, and she said I just needed to talk to the patient about it. Okay, odd, but whatever. I stroll into the room and meet a pleasant, older man sitting in his bed. The conversation immediately went weird. Me. So, what sort of problem were they having with the catheter? Were you having a lot of pain with it or something? Patient. Oh no, nothing like that. They were just putting it in the wrong hole. Me. The wrong, huh? I'm not sure I understand. Patient. Well, you know how every guy has their pee hole and their sperm hole? They were putting it in the wrong one. Me. Sir, I'm going to need to examine your penis. It turns out this guy had a hypospadia, which for his entire life he had thought was just how a penis looks, because that's what his mom told him as a child. He literally had an accessory hole in his penis and just thought, yep, that's how a penis works, a pee hole and a sperm hole. Story 91. I'm a pharmacist. I work in a primary care clinic now, but I used to work in a community pharmacy with the big three letters that none of us like to talk about: people and birth control. I have stories. Patients running out of their pills within 2 weeks because I take one and my boyfriend takes one, so the pack only lasts 2 weeks. Yes, this has happened multiple times. Patients wearing vaginal rings as accessories. Example, a nice bracelet, a nice anklet. You would think this would be obvious. But it's not people. Patients using Plan B as their normal birth control, attempting to purchase multiple doses at a time and taking after sex every time. Please, don't do this. It can be potentially dangerous. I have a lot of other stories. Pharmacists are more accessible to the public than a lot of other medical professionals, and we hear it all. Story 92. My dad, who lives by himself, had a stroke. He did not go to the hospital. 5 days later, he called my sister and said he wasn't feeling well. She took him to the ER. The doctors said that him not taking his blood pressure medicine probably saved his life, as blood was able to push past the clot. My dad still has a slur. He still thinks he's doing okay living on his own.
Story 93. I felt like a dumb patient last night when I cut an MRI short because each EMP felt like I was getting punched in the head, and I started thinking that every possible micro sliver of metal since childhood was being ripped out of me. I was just having a panic attack. Bonus. Last year, I called an ambulance because I thought I was having a heart attack. The look on the EMT's face when I said I drank 2 big glasses of red wine at 11 a.m. because I heard it was good for your heart made me cringe so hard I stopped panicking and laughed. Turns out, I was having chest pains and shortness of breath from smoking 2 packs a day for years. I have since quit. Story 94. I am a medical professional, but this isn't a professional story. A few years ago, my cousin was having reflux issues, so she went to get an endoscopy, and the night before she was scheduled to have the procedure, she asked me, "If I am pregnant, do you think they'll see the baby in the endoscopy?" I laughed for over 10 minutes before asking her, "Where do babies live?" And she replied, "Well, the stomach." She got actually pregnant not even 6 months later.
Story 95. A diabetic patient told me that he kept his blood sugar under control by using a type of moss that a Native American had told him about. My interest piqued. I asked him if he blended it with anything or just took it straight. He looked at me, confused, and said that the guy told him to just carry it around in his pocket. I told him there was no way that it was doing anything, but of course, he knew better. He had both legs amputated a couple of years later and died a year or so after that. Story 96. This one's actually about me. A few years ago, after a third bout of food poisoning which consisted of blinding pain in the lower right side of my abdomen and vomiting forest green bile, I finally decided to go to the hospital. The Uber driver was a little freaked out when I said it was probably an emergency, haha. When I finally got the internal ultrasound, the tech gasped and had the Pikachu face. Turns out my appendix had ruptured 5 months prior, and an abscess had formed which saved my life. The doctors kept asking why I hadn't come in sooner if the pain from the food poisoning was that bad. I honestly had a blast that day, though. I was treated very well because I wasn't rude or demanding, and I chatted up the staff who couldn't believe I was so relaxed while getting prepped for emergency surgery, LOL. Story 97. I'm a medical professional and have seen lots of dumb people, but we had a great one where an 80-something-year-old woman was in the ICU for an MI, heart attack, and because she was acting odd, they did a tox screen that came back positive for cocaine. One of our docs went in the room to talk to her about it, and she loudly proclaimed, "I only did it because my husband had some." Our doc told her that's not a good reason. A little later, her kids and grandkids, all probably 20 plus YO, came in to visit, and when they figured out what was going on, you just hear them yell, "Grandma!" I got a kick out of that one, Grandma living her best life. Another time when I was in college, we were all hanging out in a dorm room smoking weed with a bunch of people when a friend falls and starts having a seizure. No history of it, so we called 911, and the ambulance wanted someone to ride along with him, so I went. He was post-ictal, hazy from after seizure, and when they were questioning him in the ED, they said, "ED, so I understand you've consumed some marijuana tonight." "Friend, yes, sir. ED, how much?" "Friend, 20G. I proceeded to cry laughing, and the staff was completely confused, not understanding what he meant. Finally, I told my friend they weren't looking to pick up after work. They want to know how much you smoked. Once the staff realized, they got a kick out of it too. Maybe not totally in line with the prompt, but the last one is one of my favorite medical stories while not working at the hospital. Story 98. Not a medical professional, but we did these interviews alongside medical professionals. Back when I used to work with an organization which combated human trafficking, we encountered so many young girls, mostly teenagers, who had basically been trafficked their whole life and knew nothing about the world. They had no television, no internet, no news about anything. They were just kept in a house their entire life for men to use them. I remember we asked some of the girls about the war in Iraq. This was like 2010. And the majority did not even know there was a war. The same for World War II. They had no idea what that was, had no idea who the Nazis or Hitler was, no clue who the president was. Some of them did not even know they were in Queens, New York, having been trafficked to so many different cities over the span of just a few months. Having had no schooling whatsoever, they could barely hold a conversation because of their lack of basic vocabulary. They often just responded with single-word responses. Chronic opiate usage had destroyed their brain development. Most had overdosed multiple times by that point, often with repeated brain damage. They did not even fully understand that they had finally been rescued. They had no real concept of rescue or freedom. Upon being rescued, most would right away go back to prostitution under a local pimp, or even go back to a trafficking organization. It was harrowing beyond belief. Story 99, not a medical professional. I work in leisure, swim teacher, gymnastics coach, and senior lifeguard, etc. Lifeguarding one day during the Golden Oldies session, and I'm on cleaning rotation with another lifeguard. Young lad, great swimmer, quite new to the job, completed all his training fine. I see this fellow lifeguard pour bleach down a poolside drain and then fill his watering can with pool water. Chlorinated pool water! To also pour down the drain. Panic ensues, and I remove him from duty and sort that mess out. In the meeting, he was so oblivious as to why I had asked him to take a break. Firstly, we don't use bleaches. The cleaners have access to those for certain areas only. No access to us lifeguards on this pool, for good reasons, no spills, etc. And he should not have been in that cleaning cupboard at all, and we had no idea how it was not locked correctly. Then, when pressed why he did that, bleach, and then get the pool water, he looked so confused and said, like it will make it extra clean. Then, we had to redo his health safety handling operations training. The lot. Guy had no clue you can't mix chlorine and bleach. Story 100, pharmacist here. 2 come to mind, but I'm sure there are plenty more I'm not thinking of. Woman comes in claiming her medication was making her vomit. Says she can't remember what it is called. I look up her profile, and there is nothing recent. Just one-off antibiotics and antifungal. From almost a year ago. I asked her if it was over the counter, and she said it was. She pointed me to the Monistat cream. I thought it was incredibly strange that a vaginal cream was making her vomit. So I asked how she had been using it. She was taking it by mouth. She says she would fill the plunger with the cream and shoot it to the back of her throat and swallow it, so she wouldn't taste it as much as putting it directly on her tongue and swallowing. Another time, my coworker, another pharmacist, got served a lawsuit while I was there. The patient suffered a fall and concussion and claimed it was because her lisinopril, blood pressure medication, was increased from 10 mg to 20 mg, and she was not informed and passed out. She was suing the pharmacist, the pharmacy, her doctor's office, and the doctor themselves. It eventually came out in early discovery that she was at a rave and had a BAC of 0.18, THC, and MDMA in her system. The case against the doctor's office, doctor, and pharmacy itself fell apart right away, so she went all in on trying to sue the individual pharmacist. The pharmacy's POS system confirmed that she checked "I decline pharmacist consultation" at this time, so the case was eventually dropped.